Hi there. A year later, is there anything new in regards to treating ourselves whilst at home with coronavirus? As the majority of people who are affected with coronavirus, their experiences will be mild or asymptomatic, which can be treated at home. So doctor, if anyone is experiencing the telltale signs of the virus, what should they do to feel better?
Well, the symptoms of COVID-19, the disease caused by coronavirus, no matter which variant, include fever, a temperature above 37.8 degrees Celsius, a new continuous cough, a loss or change to your taste, shortness of breath and difficulty breathing, fatigue, headaches, sore throat, aches and pains. However, it has been found that more people suffered a sore throat with the Kent variant compared to the original strain, and a lower percentage of people lost their sense of smell and taste with the Kent variant too. If you experience fever, lose your sense of smell or taste, or develop a new continuous cough, you should self-isolate immediately. Those experiencing a mild illness don't need to seek medical attention.
What does self-isolate mean?
To self-isolate means to stay at home, not go to school, work or public places, not to attend your GP surgery. If you have to attend hospital, do not use public transport to get there. Not to use public transport, including taxis. Ask friends, family, or delivery services to do errands for you. Avoid visitors to your home, except to drop off food or supplies. If you share a house, try and stay in one room away from other members of the household. Avoid sharing towels, crockery, cutlery, or bedding.
And what do you do while you're self-isolating?
As with other viruses such as colds and flu, taking it easy and looking after yourself are crucial to your recovery. So you should drink plenty of fluids, drink enough water so that your pee is pale, clear colour. Avoid alcohol, as this will make you more dehydrated. There is also evidence that people with COVID-19 infection are prone to liver damage, which can be worsened by drinking alcohol. Get plenty of rest. You should isolate yourself at home if you have any symptoms of coronavirus and avoid any strenuous activity whilst you are unwell. Use over-the-counter medicines to treat some of your symptoms.
What medications do you recommend?
There is not currently a cure for COVID-19. The aim of treatment is to manage and reduce symptoms until you have recovered. Most people, around 80%, have an asymptomatic or mild infection which can be treated at home. In this case, you should self-isolate for at least 1 week until you have recovered. A proportion of people who contract COVID-19 will require hospital care. The likelihood of this is very low if you are young and otherwise healthy. Those who are at a higher risk of severe or critical infections include older people and those with underlying health conditions.
Painkillers?
For most viral infections, including flu and the common cold, simple painkillers such as paracetamol and NSAIDs, such as ibuprofen, are widely recommended. In the first wave of the pandemic, concerns were raised about a possible link between taking NSAIDs and developing more severe infection. In fact, this has turned out to be completely untrue. The UK's Commission on Human Medicines drew up an urgent expert working group to look at the evidence. In April, they published guidance stating that there is currently insufficient evidence to establish a link between use of ibuprofen or other NSAIDs. The susceptibility to contracting COVID-19 are the worsening of its symptoms. Patients can take paracetamol or ibuprofen when self-medicating for symptoms of COVID-19, such as fever and headache. You should follow NHS advice if you have any questions or symptoms get worse. Some of the medications and treatments you might use to treat colds and flu will also help with coronavirus symptoms. Cough medicines or cough suppressants can help reduce the cough. However, some of these preparations may or may not contain paracetamol or other painkillers, so always read the label. Throat lozenges and remedies like honey, lemon may improve a sore throat.
Natural remedies and COVID cures?
Currently, we aren't aware of any remedy to cure COVID-19, so don't be fooled by the miracle treatments some people are trying to sell. However, there is no harm in making small quantities of homemade remedies using lemon, ginger, honey, nigella sativa, or black seed in the form of a warm drink to soothe the sore throat and increase fluid intake. But anything in too much quantity can also be harmful. It also must be noted that these remedies should not distract people from washing hands and social distancing.
Steam inhalation?
There is not very much evidence that this helps. However, some people find it useful. It is very important to be careful to avoid burns and scalds, particularly with children. It should not be underestimated that steam can cause second or third degree burns. According to the Burn Foundation, hot water causes causes a third-degree burn in 1 second at 68.8 degrees Celsius, 2 seconds at 65 degrees Celsius, 5 seconds at 60 degrees Celsius, 15 seconds at 56 degrees Celsius. A safe way of inhaling steam is to sit in the bathroom with the door closed while running a hot shower to make the room steamy.
Antibiotics.
If you have antibiotics lying around at home, do not take them to treat coronavirus. As it is a virus, antibiotics will not improve coronavirus. You should never take antibiotics which haven't been prescribed for a certain condition. Antibacterial hand washes, unless they are also labelled as antiviral, cleaning products and hand sanitizers also won't necessarily be effective in killing the virus on surface of your hands for the same reasons. It's worth noting that hand sanitizers contain at least 60% alcohol, or most with at least 300 parts per million of hypochlorous acid, are effective at killing viruses. These are almost always labelled as antiviral.
And when do you seek medical attention?
Seek medical attention. If you cannot cope with your symptoms at home, your condition gets worse, you still have fever, are feeling generally unwell, or have other symptoms after a week, your symptoms haven't improved after 7 days, you should seek medical attention as soon as possible. If it's not an emergency, contact NHS 111 online. If you have no internet access, call 111. If there is an emergency and you need an ambulance, call 999 and tell the call handler that you have coronavirus. You should not see your GP or pharmacist if you think you might have coronavirus. Any routine medical or dental appointments which you had previously booked should normally be cancelled while you are sick and at home. If you are asked to attend whilst isolating or you have concerns, call the practice or hospital first.
Remember, this information is all free, so don't forget to subscribe, like, share, or follow Conscious Bites Dietitian.